ultrasound-guided intervention for the hip joint. The hip joint is a synovial joint and is very big in size. Theoretically, you can just put a needle down into the joint, and people have done this either through fluoroscopy or with landmark guided technique. But the problem is the entrance to the hip joint is in the proximity of the neurovascular bundle. So when you put the needle there, there's a high risk of puncturing the neurovascular bundle. The good news is there is something called the anteresis. That means there is some access through the anteresis and go directly into the joint. And this is the target mainly adopted by a lot of interventionists to access the hip joint. Give you a little bit of a detail about the anteresis. It's formed by the extension of the synovium and the capsule. And here you can see the anterior capsule will reflect back to form the posterior capsule in a joint with a effusion. You can see there's a lot of fluid there. But when there's not much fluid extension into the rhesus, these two will collapse. So make sure that when you put a needle in a collapsed rhesus, you should be actually between the anterior and posterior capsule. As I mentioned, the entrance of the joint is in close proximity to the neurovascular bundle. So if you use a landmark guided technique, which people have done this before, there's a very high chance, 1 in 4, you may injure the femoral nerve. And also the accuracy is not that high. But when you use an ultrasound to guide a needle to the anterior rhesus, the success rate is very high. There's many described technique, whether you use a linear probe or the curved probe, whether you go from above to below or below to above. Just pick your technique. The one that I used to do is to scan and find the femoral head. I use the curved linear probe because a lot of patients refer to me, they have a high BMI. So the first scan is very similar to what anesthesiologists try to do to scan the neurovascular bundle, find the femoral artery, and you can see the patinus and iliopsoas muscle. But then when you look carefully, you can see the femoral head in the deep part of the scan. Now this is important. Once you see the femoral head, that means you know how to pivot the ultrasound so that you can see the femoral head and the neck. Once you align this like this, you can see the acetabulum, you can see the femoral head and the neck, and you can see the labrum there, and you can see the anteresis, and this is the target where you want with the needle. I just give you a little bit of detail about the sonal anatomy. This is the anteresis, and you can see a space quite voluminous between the head and the neck, and then the overline with the iliopsoas muscle and the other hip muscle. Now there's one thing very important before you put the needle there. Just remember there is an artery. Either it's a lateral circumflex or the branch of lateral circumflex. It's somehow consistently just along the needle track or the trajectory. So always try to look for this and see whether you can avoid puncturing the artery, because it will be very, very embarrassing if you actually causing a big hematoma after you fix the hip joint pain. All right, assuming you find the femoral artery, and you can determine the best trajectory of the needle, and you put the needle there, it is important to make sure that you touch the bone and hydrolocate and make sure that the injector is spread and along this anteresis there. I'm showing this video here, which show you the hip joint injection. You align the probe between the head and the neck, which is shown here, and you can see the anteresis. After you scout there's no artery in the trajectory, then you put a needle, which is a needle. And it's important actually is that after you touch the bone, you hydrolocate to make sure the injector is spread within the anteresis and actually going towards the joint, because the ultimate idea is to inject into the joint. I just show you X-ray after injected contrast, show that to show you and convince you that injecting into anteresis is a true intra-articular injection. Thank you very much.